Good morning, I'm Diane Macedo. Thanks for streaming with us. In today's update, President Trump has signed the COVID-19 relief bill to avoid a government shutdown. The $900 billion bill includes $600 checks for Americans who earn less than $75,000 a year. It provides government funding through September 2021 as well. And despite signing it, the president says he opposes a lot of what's in the bill and is demanding more money be sent directly to Americans. The House will vote today to increase those stimulus checks, but only a handful of Republican senators have signaled support for those higher checks. Police have identified a suspect in the Christmas Day bombing in Nashville. They say Anthony Quinn Warner died in the RV explosion and was not on law enforcement's radar before the bombing. Authorities believe the RV was parked in front of an AT&T transmission building early Friday morning. Law enforcement sources tell ABC News that investigators are determining whether the suspect may have been motivated, at least in part, by paranoia over 5G cellular technology. And despite the worsening COVID crisis, millions of Americans are traveling for the holidays. Yesterday, TSA screened more than 1.2 million people at U.S. airports, the highest number since the pandemic started. Meanwhile, December is officially the worst month yet in the pandemic, with nearly 5.3 million COVID-19 cases and 63,000 deaths in the U.S. this month so far. Now, public health officials are warning of a major surge after Christmas and New Year gatherings that could overwhelm hospitals already under pressure. And joining me now for more on the latest in the pandemic is infectious disease specialist and ABC News medical contributor Dr. Todd Ellerin. Dr. Ellerin, good morning. Hope you had a safe and Merry Christmas. You know, sad that we have to go back to this topic, but given the high travel numbers that we're seeing and Dr. Fauci's warning of a Christmas and New Year surge, what should we expect in the next few weeks? How worried are you?
Yeah, Merry Christmas, Diane. I hope yours was fun as well and restful. You know, the concern, as we've seen it before, is we surge after holidays, and especially the fact that you have Thanksgiving on the heels of Christmas, on the heels of New Year's. We're just going to see a multiplier effect here, and we are going to see more cases. Now, we have to be careful because, remember, the country is not entirely even. We have a bit of a tapestry here, and so when you hear about cases going down in the Midwest, I mean, that's encouraging, but I want to warn people that around the holidays, sometimes the analytics, you know, people who are used to giving us numbers and data crunching are also on holidays. They should be. So sometimes there are delays, and I wouldn't be surprised if we see spikes even in places where we're seeing decreasing case counts. We have to be really careful. And
a few countries have now reported cases of that new coronavirus strain first found in the UK, including Canada. So given how that and what we're seeing with this strain, how likely do you think it is that it's already here?
I'd be shocked if it weren't here already. I think what's really important is that the United States needs to really ramp up our sequencing of the virus. We're doing far too few analysis of our viruses, so we don't really know if we have the variant here. Yes, we've done some limited testing, haven't seen it yet, but I suspect that if we start doing robust sequencing, we're going to find out that it is here.
And intensive care units are filling up in hospitals across the country. A New York Times analysis earlier this month found that 78% of ICU beds nationwide were occupied. So what impact does this have on hospitals beyond just not having enough space?
Diane, we have a crisis of capacity right now. We have too much virus, too much transmission, too few hospital beds, and especially too few ICU beds. But as you know, it's not just about creating more intensive care unit beds, because we also need the staff to take care of those patients who are in those beds. In the spring, we had regional transmission, so we could borrow people from other parts of the country who had enough courage and compassion to come to us or for us to go to them. This time it's much different as we have widespread transmission. I can tell you in our own intensive care unit, we are really doubling our efforts right now. We have a packed ICU. We have had to develop alternative cares sites in order to care for these patients. This is really scary right now. And remember, it's not just about the COVID-19 patients. This also impacts the non-COVID-19 patients, our heart attacks, our strokes, our patients with cancer, etc. So we really have to dial down the cases so we don't put that much more pressure on our intensive care units.
Well, and you hit on another point that I wanted to ask you about, which is, a lot of people, when they think about this, they think only of their risk of COVID-19. But if the ICU is full, what happens if you get into a car crash?
That's the concern. If your ICU is full, that means you have to find other parts of your hospital that can care for these patients. Finding the beds isn't just the rate limiting step. It's also making sure you can't just have any person come in. For example, I'm not an intensivist. I see critically ill infectious disease patients, but we need our specialized intensivists to really care for the sickest patients. And remember, the demand right now is exceeding the supply.
And Operation Warp Speed reported that they anticipated vaccinating 20 million people by the end of the year. So far in this country, 10.8 million vaccine doses have been delivered, and only about 2 million have been actually administered. So does that worry you that we're off pace?
It really is worrisome. I mean, as you know, it's not just about the building the vaccines, the manufacturing. We have to find the right cadence between manufacturing, distribution, and acceptance. And that is a major challenge right now. I'm not surprised that we're behind, because in the beginning you expect there to be missteps. I really hope over the ensuing weeks that we're going to see a significant increase in the uptake.
So too, Dr. Todd Ellerin, thank you as always.
Thanks, Diane.
And Christmas is over, but retailers are still trying to draw in those holiday shoppers. Many are announcing big savings, trying to bring in last-minute customers before the new year. ABC News Chief Business Correspondent Rebecca Jarvis has more on that. Rebecca, good morning.
This has been a year like no other, and yet there is one thing you can always count on, and those are the post-Christmas sales. They're going on right now, where you can score deep discounts across the board on things you might actually want. Things like clothing, up to 75% off on sweaters, winter gear, mittens, gloves, the types of things you would actually use right now. A number of retailers are trying to clear out that inventory, score those extra purchases for the end of the year, and so you can find up to 75% off discounts on top of what is already on clearance. Another area are those small gifts, things that are seasonal, holiday gifts, lotions, perfumes, gift sets. Those types of items also go on sale this year. They are often associated with a particular year, 2020, but often you can find them without that packaging, which specifically says holiday 2020. So it's a great time to stock up on those. Keep them in the back of the closet for birthday parties, small gifts, teachers, for example, nurses whom you appreciate. All a good thing to keep on hand, and a great deal you can find this time of year. Toys also are on big sale right now. A lot of the hottest items of the season, which are seasonal, are going on sale now, up to 70% off. It's a great thing to keep in the back of the closet for kids' birthday parties. And finally, Christmas decorations, Diane. Christmas decorations are always on sale after Christmas, and this is the best time of year if you want to buy wrapping paper. Diane?
If you've got the storage space, you can make some serious savings. Rebecca Jarvis, thank you. And now for your latest science and technology headlines, here's Kenneth Moten.
In today's Tech Bites, a step towards zero-emission air travel. Researchers at Oxford University have reportedly turned carbon dioxide into jet fuel. They say the process is simpler and less expensive than other alternate fuel possibilities, and they're in talks with industrial partners about production. Two Danish architects have just finished a 2-month test of a collapsible shelter they like to see used on the moon. The test took place in a remote part of Greenland. The shelter is designed to take up minimum space on moon-bound spacecraft. And Tesla's new software update will allow drivers to change the sound of their horn with preloaded noises, including goats and other animals. Tesla CEO Elon Musk even tweeted about it without mentioning a certain bodily function, which is also an option. Those are your Tech Bites. Diane, because I am no longer a middle school age boy, I will not make any jokes. Back to you.
That's one way to clear the lane for traffic, Kenneth. Thanks. And that does it for this ABC News Live update. I am Diane Macedo. Thanks for joining us. And remember, ABC News Live is here for you all day with the latest news, context, and analysis. I'll see you back here at 3 p.m. Eastern with Terry Moran for the breakdown. Have a great day.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.